Hello, everyone. Thank you so much for joining us for today's CHXD webinar, Designing a More Humane Workplace, Supporting Employees that Juggle Working and Caregiving. My name is Catherine Houtman, and I am the Director of the Center for Health Experience Design. And just a few slides about who we are before we kick into the main content. So the Center for Health Experience Design is an organization within MADPOW. And MADPOW is a strategic design agency that leverages strategic design and the psychology of motivation to create innovative experiences and compelling digital solutions that are good for people and good for business. And the Center for Health Experience Design, it's a community of over 800 professionals and a range of organizations in the health space, where our partners include fledgling startups and global corporations. And what the Center for Health Experience Design is, we're an organization that is focused on collaboration. So our role is really to piece together and govern multi-stakeholder initiatives that are open to and will benefit the greater community. And by what I mean by that is, we work on those bigger problems, such as like, how might you solve medical bankruptcy? No company or even government organization can solve that on their own. So we look to like bringing together multiple organizations to work together on solving a challenge that has a higher purpose. We have a membership model as well as a project model, and it's about accelerating your personal innovation efforts. So if you're interested in expanding a lightweight way to extend your team or bring in niche expertise, we offer access to subject matter experts, MADPOW design services, discounts on our upcoming conference HXD, and our workshops, and much more. You can simply visit centerhxd.com to learn more. And as I just mentioned, we have our Big Health Experience Design Conference. This has been our annual event for almost 10 years. So the conference will be April 14th and 15th of next year in Boston, Massachusetts. And it's a conference that's focused on improving health experiences through strategic design. We have over 500 organizations that are there, 500 executives, innovators, practitioners, entrepreneurs, clinicians. We have attendees from health insurance to digital startups. It's a very creative and engaged group of people that attend to this. And our registration is now open, as well as more information about what we might be talking about. So you can go to our conference website at hxdconf.com to learn more. And the just a little bit, we are using GoToWebinar for this presentation. Jerry will be presenting for about 45 minutes, and then will be 10 minutes will be left at the end to answer any questions. If you have any questions that arise, it can be during her presentation or at the end. Just feel free to enter them within the question box on the right-hand side as shown here in this illustration. And if we run out of time, we'll be providing our email addresses so that you can email us directly with anything we might not get to within this webinar. So let me hand it over to Jerry Baumblatt, who will talk to you about designing a more humane workplace.
Thanks, Catherine. So I'm Jerry, and what you see here is actually a picture of me with my mom, who was recently being discharged from the hospital. But I myself have had a lot of experience both working while trying to caregive, both independently and while working for an employer. And so that's really what we want to focus on today, is people who are employees who are also family caregivers, because this is an increasing challenge for employers, for employees to stay employed and be able to continue to work or to be productive, and also for managers and really everybody in between, as this becomes increasingly common challenge for people. This is the Difference Collaborative, which I'm a co-founder of, along with George, Carol, Olga, and Pete. And we're really trying to think, to Catherine's point, about how we might collaboratively address this. So working with employers, co-designing with leadership teams and employees, working also with people who create products and services for employees who are caregivers, as well as with researchers and people in policy and advocacy. This is really a very wicked problem. with a lot of moving parts where we think we need all the stakeholders involved to really move the needle. And our research partners right now are Dr. Ginger Hansen, who's at the Johns Hopkins School of Nursing. And Ginger focuses on occupational health psychology, work life and integration, and did a lot of work in system science and applied industrial organizational psychology. And then Jiaying, who's joining me today on this webinar, has really focused on improving health outcomes for unpaid family caregivers and developing sustainable interventions to maximize support structures in the workplace, whether that's policies or other types of interventions. And she really works at the intersection of chronic disease management, family dynamics, and workforce and policy research. So she's joining me today as they're helping us both move our research forward from where we left off and publish our current research, which we'll talk about today. Okay, so I'm going to hand it off now to Jiaying to talk about who are family caregivers.
Thanks, Jerry, for the introduction. So, first to begin, we're talking about this because family caregivers can be a little confusing to describe for some people because there's different definitions of family caregivers. But for this webinar, what we define as family caregivers are individuals who are unpaid and helping someone who's a family or friend or someone they're close to. We want to distinguish this from individuals who might be coming to the home as a paid person to help care for somebody or a professional caregiver, such as a nurse. Here's a list of some of the things that family caregivers do. We like to point this out because there are a lot of things that caregivers do, and this is on top of everything else they were doing for themselves, their workplace, their other family members to begin with. So it's why caregiving can get a little crazy sometimes. And some of these items you probably have seen or heard about before, or you realize they're part of caregiving, such as bathing and grooming, but other tasks are not as commonly thought about, such as navigating social services or managing care transitions, let's say, between the hospital to the home. And oftentimes when I talk to people about caregiving, they often think, oh, an elderly female who's taking care of somebody. But we want to point out that this is not the case anymore. The generation of caregivers we have currently are younger now more than ever. So 1 in 4 of caregivers currently are millennials. And millennials are also more likely to care for someone with emotional or health issues. And that's important to point out because oftentimes we think about caregiving for somebody with a physical ailment, but that's not the only type of caregiving. And mental health is a very difficult type of caregiving experience that can often last for many, many years, if not a lifetime. Also, people are caring for more than one person, approximately half are men. And particular to this crowd that might be of interest is that 50% of employees in a pretty young age range from 26 to 35 reported already leaving a job to caregive. So this is really changing the landscape of the workforce and jobs. Trying to advance here. Okay, so now we would like to hear from all of you and learn a little bit more about why you are interested in this webinar. Okay, great. So we can see that a little more than half of you have been a caregiver or currently is a caregiver. And then there's a nice range of individuals who are working in HR or interested because they're in the leadership team or other. Haven't seen anything in the chat box yet. Okay. So Voya completed a study with these working caregivers, and they asked them about what kind of effects it had on their work. More than half of them said they cut back on work hours, which is not surprising. But then if you look at the next two statistics, almost a third said they left one job for another, and almost a quarter said they quit work entirely. And this is important because they also found that these individuals were likely some of the highest performing talent. So we don't want these individuals leaving the workplace, unlike some employees who maybe are not as valuable. So this is important thing to think about as a employer. Next, they also found that a lot of the individuals, 90%, lacked company support. Maybe that's one of the reasons why they left or switched positions. Some of them were also afraid to tell their employer. It definitely added stress to their work, and 83% reported taking double the days off as a working caregiver versus a coworker who was not a caregiver. And then we also want to point out that the duration of caregiving can be quite long. The median amount of time people are caregiving is 5 years. The average is 4.3, so it's about the same as the median. And some people are even caring for individuals for more than 10 years. And the reason why we like to point this out is because oftentimes the employee and the employer, they have no idea how long of a experience this caregiving process is going to be. And it could be something like the employee gets a call about their parent in the hospital, and the employer thinks, oh, well, you can have a couple days off to take care of this person, not realizing that this is just the beginning of a potentially very long journey. So next, in the next set of slides, we'll talk about the impact of caregiving on health and well-being. Some things to point out about these slides is that many of the studies on caregivers are very specific to different disease groups, such as dementia or cancer caregiving, or they're very specific to child caregiving versus older adult caregiving, and they tend to be smaller in sample size, but overall they have generally found they've commonly found these things, these health effects that are both positive and negative to caregiving. So one of the things is depression and anxiety, where caregivers are at higher risk for having clinically significant symptoms of depression. Significant because depression is notoriously difficult to treat because individuals can hide it. Also, there is a paucity of qualified and quality mental health care providers, and there's also a stigma attached to depression. We also know that caregivers report poor sleep, and it's not just the quantity of sleep that's decreasing, but also the quality of sleep that's decreasing. So in this case, these are caregivers for individuals with brain tumors, sleeping less and arousing an average of 8.3 times a night. That's a lot of times waking up in the middle of the night. You're not getting quality sleep, which is huge for performance. Also, individuals are more likely to have risky health behaviors, such as drinking alcohol or smoking more. This could, in turn, increase the risk that they have for different types of diseases. It's also a decrease in general well-being, which we describe as frailty. People are more tired, they're less physically strong, they're not eating, and they're losing weight. We also know from the professional caregiving literature, from nurses and nursing aides and those types of professions, that they're more likely to have injuries. So imagine a family caregiver who isn't even trained doing these different tasks that professional caregivers are doing, such as transfers and lifts and bathing. This creates a lot of physical strain on them, which in turn can lead to injuries and back pain, which has lasting effects over years and years. It's not just short term. And of course, it increases the chance of having stroke or heart disease. All these terrible things I'm talking to you about probably scares everyone about the risks of being a caregiver. And stroke and heart disease, it's because of the increase in inflammation, inflammatory markers, which we know increases cardiovascular disease risk. And then on the social side, we know that caregivers, because they're spending so much time and energy on caregiving itself and potentially taking care of themselves if they have the time, they no longer have any energy left to maintain relationships. And often this is something that they don't even realize until they're sitting there months after starting caregiving and they realize they haven't seen their friends in months. So it's something that creeps up on them. But on the flip side, there are some positives to caregiving, and I don't want to just focus on the negatives, because caregivers have reported that they appreciate life more because they're feeling that they're giving back to their family and have more purpose in their life. They grow personally and feel that they are more self-confident, have more self-efficacy in doing different tasks, and they have closer relationships with the people they're caring for. So overall, very specifically to working caregivers, not surprising since we just covered all these different negative things that can happen with caregivers, 55% said that their physical health had diminished. But the important thing about this is that even when they said their physical health was diminishing, people were not tending to their own medical needs. So these are individuals who are becoming sicker, but also not seeking care for it, which can in turn lead to even more illness in the long run and poorer health. So it's not surprising that there's an estimated 8% increase in healthcare costs for employers when their employees become caregivers. And that's an estimated $13.4 billion a year. It's quite a bit. So when individuals become caregivers, oftentimes they realize, well, I might have to do, bathing tasks and transportation, that sort of thing. But they don't realize all the other things that come along with caregiving, such as social isolation, which we just talked about, family strife, where there's differences in opinion about making decisions, for instance, the disruption they may have with their work, and also that they're caregivers themselves. And this is because family caregivers often don't self-identify as family caregivers, which is a problem because this decreases the chance of them being linked to services and resources in the community and also within the healthcare system that could be labeled as caregiver. Typically in the healthcare setting, providers describe individuals who are helping somebody in the home as a family caregiver. And so if you don't identify as a caregiver, it can be difficult to explain what you're doing to healthcare team members, for instance, and it also decreases a sense of having a community around you, realizing that there's other people who are caregiving, which leads to more social isolation, and you don't feel like it's a normal experience, which it is because there are many, many people out there who are caregivers. But if you don't identify that way, then you're not getting that support from both the community at large, support groups that are potentially there, the healthcare community, and also not getting resources potentially. Oop. Okay, so with all these different things that are happening with caregivers and the potential downsides to being a caregiver and also positives, there's lots of opportunities to consider in how we can help people both be a caregiver and worker at the same time and really thrive in both roles. We know it's possible. The problem is we just don't know how people are doing it well, like what kinds of characteristics do these people have or their workplaces have, and we don't know what type of things to measure when it's working well, other than they're staying in the workplace. And we also know because individuals are at higher risk for poor physical and emotional health, helping caregivers in advance or employees who may become caregivers can be a form of preventative medicine. So really thinking about a way to change the culture of care in the workplace to improve the future of work for everyone. So now I'm going to turn it over to Jerry to talk about the nurse family caregiving survey.
Thanks, Jiang. Yeah, so really what we wanted to do at the Difference Collaborative when we were thinking about this is Voya and Harvard, the Caring Company, like there have been these kind of recurring general surveys of employees who are caregivers. And we said, what can we learn if we really focus on a specific type of worker or group that's engaging in caregiving? Like what else could we learn? Because it's so hard to figure out how to go in and address this problem. You have shift workers, you have knowledge workers, you have people who travel a lot, and these all offer different challenges. And we also wanted just to understand that experience. So this was done in 2018 in partnership with the Society for Participatory Medicine. And we were able to survey about 200 nurse family caregivers. And then we did a mirror survey of people who were managers and leaders of nurses. So whether they were a chief experience officer or a CEO at a hospital, a chief nursing officer, or actually like a nurse manager, they could take this mirror survey so that we could understand their experience. So I'm going to walk you through what we learned because this is a very interesting way to kind of start digging into how can we help different types of caregivers. And one of the first things that assumptions that I think people make, including their own families, is people say, oh, well, you're a nurse, so you do this professionally. It must be pretty easy for you to come in and care for a family member because you're trained in hands-on care. And really, the first thing that we heard is that even from nurses, for nurses, there has to be support to aid nurses who are caregivers who work in the medical profession. That we assume that we're okay because they're qualified professionally, but they say when it's a loved one, it's still a totally different ballgame. So you may not be working in your own health system. My friend had to suddenly help care for her father, who is a vet, and had to learn the whole VA system, which was completely different than what she was used to. And of course, you're dealing with all the family dynamics and all these other things that come into play. It's not like you have necessarily that kind of clinical boundary that's in place. So one of the first things we asked them was, how has family caregiving impacted your own health and well-being? So to the information that Jiaying went through earlier, we heard a lot about increased stress and sleep issues. And by the way, we know that sleep is probably by far the top thing for your health and happiness. So if that's not going well, again, loss of social life, family strife, depression, loneliness, their own worsening of existing health problems or new health problems. And then there were a few people who said, yeah, but I did have actually some improved family dynamics or found some improved well-being from this. So again, we do see those opportunities are there. We're just not really exploiting those very well. And instead people are having their own really serious issues with their own health care. Things that we heard from them, that they're having trouble sleeping, gaining weight. One nurse said they went from being an active middle-aged woman to living a life alongside 80-year-olds and developmentally challenged youth. How it's hard to keep self-care as a priority, and that there's this background stress, that fear of job loss is constant, which I think creates a kind of irony for somebody who's a professional caregiver, that caring for their own family is putting their professional caregiving in jeopardy. Is a very strange situation to be in. We obviously heard a lot about, you can see most people on a scale of 0 to 4, the nurses felt like this was really contributing to their life stress. Not a big surprise there. And then we asked about challenges returning to work. So whether they were taking time off from work for extended caregiving or because the family member they were caring for passed away. Really a quarter said of nurses said it was hard for them to engage and focus when they came back to work, that this is something that needs to be addressed, kind of helping people segue back in. 21% had a hard time managing that same stress level at work. In fact, we even had a couple of people who talked about PTSD, how they had gone through extremely traumatic end of life situations with the person they were caring for, and then they were supposed to go back and work in like the ICU or something like that. It was just too close to home and too traumatic for them. That they had trouble keeping up with procedural changes, and that it was difficult sometimes for them to reconnect with coworkers. So now that was the nurse responses. And what's interesting is then we also asked, of course, the hospital leadership and nurse managers. And what we see as a trend throughout all of this is that if you're just reporting on yourself, you think it's a problem, but the managers and the hospital leadership actually think these things are even bigger problems. So as you can see, as opposed to 25% having a hard time engaging and focusing when they come back, they thought it was much higher. Same thing with trouble keeping up with procedure changes. Only 14% said they knew they had trouble with that, but hospital managers and leadership see this as a much bigger problem. We also asked them if it contributed to any problems at their organization. Now, some of these we were expecting, like staffing issues, and census is a real challenge, right? When a nurse leaves or takes extended leave or needs to take sudden leave, they have to suddenly bring somebody else in from registry. That's always going to be a challenge. One of the things that we were really surprised by, considering all the discussion in the hospital workplace about clinician burnout, is we really don't hear much about how personal issues like personal family caregiving. Here, 46% of nurses said that it really contributed to their burnout. And again, I think you see that issue of they're burning the candle at both ends. They're professionally caregiving, they're going home. They're personally caregiving, they're not getting a break, and they may be experiencing that irony of, hey, come in and take great care of other people's patients and families, but not necessarily getting the support to take care of their own families. 22% said team dynamics, and 10% said that they also thought that caregiving was, a personal caregiving was impacting the quality of care delivery. And again, when we went back to hospital leaders and nurse managers, they thought these problems were even bigger for the most part. You can see how 65% thought that it was an issue for staffing and census, and they actually thought the problem with quality of care delivery was more significant as well as team dynamics, and about the same recognition that this is having an impact on clinician burnout. We then asked if family caregiving is on the radar of the leadership at your organization. So this is us asking the nurses. And you can see that just a small number thought that it was a high priority. A larger group said somewhat, and others were just like, I have no idea. What's interesting is we also asked managers and leadership about this, and again, we got slightly higher numbers saying that yes, it's on the radar or it's a priority, like a little more than half. But then when we asked them, well, so what is your organization doing? They said, oh, well, we have FMLA, which is federally mandated leave. So it wasn't really them providing any resources other than what the government says they absolutely have to provide, even though they think it's on the radar of their leadership. So we're seeing a little bit of a disconnect there, obviously. We also asked nurses how comfortable they'd be talking to their manager to plan for ongoing and urgent family caregiving challenges. So again, it's a healthcare setting where we should have a better understanding of what it means to be a family caregiver. And while 33% said they were very comfortable, you can see about a quarter was uncomfortable or very uncomfortable, which is still, about 1 in 4, which is not great, and kind of syncs up a bit with what we heard from the Voya study, where about 17% said they're still uncomfortable talking to their manager. And when we dug into, so I'll get back to that a little bit more later when we talk about teams. We also asked in terms of retaining people or going someplace new, how much would it change that for you as a nurse if your organization or a new organization offered comprehensive policies, procedures, and resources to support family caregivers? Would that influence your employment choice to either stay at your organization or join a new organization? And you can see that 47 and 27% said a great deal, or that this was very significant. So obviously a huge opportunity here if you want to be an employer of choice and really retain the good people that you have, to kind of put something that's more comprehensive together to help address this in the workplace. And then we asked, how do your coworkers respond when you or somebody on your team is caregiving? So again, fellow nurses who do this professionally, who understand how challenging this is. And it's great that they said they were very supportive for the most part. And then you still have a significant slice of people saying that, well, they don't know, or they might even be unsupportive. And when we dug into this a little bit more, We really found a lot of different issues. So this first one is interesting. One nurse said the leadership always expressed concern and supported me 100% and enabled me to adjust my schedule. But then there was this big but. But even though this person felt supported 100%, they were still reluctant to use their time off for fear it was somehow going to count against them. So there's this difference between thinking, oh, well, I know these people support me, to saying, yeah, but there's not really clear policies on this, and I still don't feel totally safe doing this. Like this is somehow still gonna bite me when it comes down to it. Um, Other people saying that they just barely qualified for FMLA and didn't really feel like they were getting the support to take the time off. We heard a lot about how this was very manager dependent, which I think is a problem across the workplace, that it comes down too often to, do you have a manager that gets it? And then how empowered is that manager to really work with you on this? But what we heard over and over again was, well, my manager was very understanding short term, but not long term. So back to what Jiaying was talking about with the duration of caregiving, we don't really have this in our sites that we think, oh, if I just give you a few weeks off or even a month off, that's going to take care of it, right? And it's like, no, caregiving is going on for 5 years. And over time, we see that compassion fatigue where people kind of don't get it. And then we even heard about how coworkers might shame you for not picking up shifts. And again, not really necessarily understanding how this is impacting you over the long term. Um, we really heard that this can go either way, that it doesn't have a null effect on teams, that it's either going to help forge a stronger team or it's going to erode the team. So we heard that, hey, we all find ways to support each other, donating PTO, bringing meals, switching shifts, and we bond on those highs and lows. Versus we heard people begrudge me extended leave and it's made for a hostile work environment. And so this is where we really can see how this is either going to make it stronger or it's going to start to really break things down. And one of the questions we have too is, it's great that people can do things like donate PTO and switch shifts, but as this becomes an increasingly more common problem and you have larger and larger numbers of nurses or employees who are dealing with family caregiving, is that really going to be a solution? We can't just all continually donate PTO to each other and think that that's going to solve the time off problem. See if it'll let me. Here we go. So then the other thing we asked, thinking about opportunities here, you have nurses who are actually working with patients and families, but then they're having this experience, this very real life experience on the other side of the bed as a family caregiver. So we said, what have you learned as a family caregiver that could really inform the way you and your organization interact with patients and families? And we heard a lot of great things, like real ideas for policy changes, like, hey, we should let a family member stay overnight. I was able to do that with my mom, and it was incredibly rewarding, and it helped her stay calm, and it helped me as well. And them saying that this really improves their ability to help family caregivers understand the road ahead of them and the commitment and the duration of caregiving, and that they're stronger advocates now. When we asked leadership about this, though, and even nurses, like, well, how is this being formally leveraged in the workplace? Basically, we heard that it's not, that nobody is saying to a nurse who comes back, hey, what was your experience and how can we learn from it? Which would really be a way both to honor their experience and also help them come back into the workplace in a much more meaningful way where their experience is going to have an impact. Let's see if it'll let me. There we go. So our question really, as we start to think about this example of nurses in the workplace, but really all employees, is how can we minimize these negative effects of caregiving on the employee's health and well-being and the stress levels and the team dynamics, and really amplify the positive effects and see how that might be an opportunity to create a better future of work for everybody. So that's where we are right now. And we really want to take the next poll now that we've kind of given you a deeper dive into some of this. So really, what is the most meaningful thing we want to know that you think employers could do to help caregivers? So some of the things that are out there are paid leave and flex time because FMLA is federally mandated but unpaid leave, care coordination services, manager training, culture change and awareness raising, or do you have another idea that's not listed here as one of these four? And if you do type in other one, choose other, feel free to type your idea of what that would be into the chat window. Okay, so it looks like about 56%, that's pretty interesting, say culture change and awareness raising, which I think is a huge issue, kind of at the foundation of all of this. 33% said paid leave, and then 11% said care coordination services. So very quickly, I'll talk about what nurses said they wanted, because we asked them this question as well. We actually didn't ask explicitly about culture change, but what they said was they wanted help with care coordination, that even as nurses, they felt really lost and could use a lot of help and felt a lot of thrash around that. Interestingly, they wanted personal counseling, they wanted in-person support and affinity groups, and financial counseling. So you can see here, there were a lot of interesting things that came up, but care coordination was really at the top of the list despite their professional expertise in this area. So now I'm gonna hand it back off to Jiaying, who's gonna talk a little bit more about what other workplaces have found.
So we know from, I believe this was the Harvard study, is that right, Jerry?
Yes, it was.
Okay, that the top three things that working caregivers wanted were referral services, paid time off, and flexible work hours, and that the bottom three things were unpaid leave, caregiving classes, and voluntary cuts in hours. I think the next couple of slides is going to be sort of a back and forth between Jerry and I, more of a discussion than the previous slides where we were just presenting. And let me see if I can go forward, since I had some trouble with that earlier. It looks like, uh-oh, is it stuck? Okay, here we go. So interestingly, since a lot of people, I think it was like 50 something percent, said that one of the most important things would be culture change, we kind of mapped it out here at the different levels of shifting culture from the individual, department, employer to society. And we feel like raising awareness is can be done at all of these different levels. From the society level, it's about helping people understand what caregiving is and also the potential harms and benefits from it, and realizing that it can be a very long experience and not just a couple days. And then from the employer perspective, helping caregivers have support through different structures and policies or programs that might be available. So, for example, the thing about care coordination services, that could be something that an employer, for instance, offers to support a caregiver, or that the leadership in the organization kind of models that it's okay to take time off, for instance, to caregive or for family responsibilities. At the department level, we'll have more about this in the next slide. It's really supporting the manager, who's the linchpin and often is navigating and trying to satisfy both the individual employees as well as the employer, in helping caregivers, but also having the structural support to help the managers be able to be supportive, but also not have any detrimental effects on their team dynamics or productivity and that sort of thing. And then at the individual level, realizing that it can be difficult to tell supervisors about your caregiving responsibilities or what you are doing, and helping people navigate that process, but also figuring out, how to tell individuals what the types of what resources are out there and what supports are out there, both at the organizational level as well as the society level, because oftentimes it's why people hear about resources through word of mouth. And so it's very important to relay that information to others who might need it.
Yeah, and Jiaying, I just wanted to bring up, like you were saying before, about how family caregivers don't self-identify. I know that's a
Yeah.
very kind of odd concept sometimes, but like I, for example, was working, literally building resources for patients and families while I was going through family caregiving and not recognizing it. And it never occurred to me. I kept thinking of my mom since she was the primary caregiver, wasn't really seeing myself as doing that and not recognizing there might be resources for me. But then again, if you don't have that awareness raising to help people identify, could a manager or could a colleague have said to me, hey, I know you're in the middle of this chaos right now, but actually there are some resources that could help. And unfortunately, in my case, that wasn't said to me until caregiving was over, that there would have been things that could have been done. And I was like, oh, it never crossed my mind. I was anxious that I was jumping out of meetings to take phone calls and coming in late and leaving early and taking unexpected leave. And so you really do feel like you don't want to draw attention to it. So normalizing that and helping people understand it, even if you roll out these policies and services, they're just not going to get utilized if we don't do that awareness raising and that culture change, so that there's multiple, like you're showing here, multiple points where there might be somebody who could have come to me and said, hey, we don't want to lose you, but we also want to make sure you get through this, and that you don't become kind of a casualty either in terms of your health or your ability to stay in your role. So I think that's really important, that culture change piece and that awareness raising.
Yeah, and I also think a lot of people just don't know what to say, honestly,
Mm-hmm.
when someone is going through something like family caregiving, especially if it's for a long period of time or it's like towards the end of life. I had a nurse colleague one time. So I'm a nurse. I was working with a bunch of nurses. My grandmother was dying, and when she died, one of my colleagues said to me, "Oh, well, it's okay." And I just thought, "What? Do you realize what you're saying to me here?" And we're healthcare providers. Like, you would think that we would be more aware of, the appropriate things to say when caregiving ends or when caregiving is happening, but that's not necessarily the case either. So I feel like this awareness raising is for everyone. It's not just individuals who aren't aware of caregiving.
Right. And managers are really kind of in this pivotal key role where they need to be compassionate, to your point here, to employees, and
Yeah.
really help plan with them and figure out what that means. And yet, how are they getting support from leadership, right? To really be empowered to do that, to know what is and isn't okay to do, and to make sure that they understand how this impacts their teams, whether that's dates and deliverables or staffing or whatever that might be, so that it doesn't become this thing where people are starting to worry about their bonus or worry about their hours because somebody on their team is having a significant caregiving experience.
Right. And we talked about things like possibly, I forget what the exact term is, but training multiple individuals to do the same type of task so that if someone needs to be on leave, there is somebody who can take over. I think was that cross training, something like
Yeah,
that?
that and just having more redundancy, right,
Right.
across roles, so that it's not like this panic to try and figure out who knows what's going on if somebody needs to suddenly be away for caregiving.
So we kind of mentioned this already about benefits, and people not being able to find it or not self-identifying as caregivers. So even if benefits are available, they're not able to find it because they're not identifying themselves as caregivers, and the benefit is labeled as a caregiving benefit. And we just want to point this out because I feel like a lot of times employers might think that, oh, well, I have these benefits, they're amazing, they can help people who are caregivers, but then no one uses them. And so here are some of the reasons why, and we've already discussed a couple of these.
Yeah, exactly. And there's this just in time issue, right? Like even if you train people on these benefits when they come in, people need to help remind each other, or somehow the workplace needs to identify when one of these benefits could really support somebody in a meaningful way. I did talk to one employer who did a great job understanding that something like a care coordination service would be a huge help, and they actually rolled out 6 free hours of geriatric care management for every employee, and yet the utilization on that was, I think, below 3%, because people didn't understand what that was. They were kind of scared to start to use it. What happened beyond the 6 hours? Were they going to get, stuck with some kind of large payment they had to make? So has to go beyond just telling people about these benefits when we're onboarding them as new employees or during like an annual, update.
So we would like to ask all of you, how would you define the success of a workplace effort such as a program or benefit to support caregiving for either yourself or the individual? Because oftentimes one of the things that we found to be very challenging and not standardized across the board is how do organizations and individuals define a workplace benefit that's actually working? Like, how do you figure out if it's actually working or not, other than the typical turnover rates, where there's some of the other common ones that we see?
Yeah,
Time.
really about like time off, or are we retaining people or able to attract new people? But there hasn't been, most workplaces aren't even identifying caregivers. They're not even finding out how many people in our workplace are dealing with this. So if you're going to roll out solutions or supports or services or policies, how would you measure whether or not that's having a meaningful impact on the individuals, the employees, or the organization?
And so you can type your response into the chat box. And I just want to say that this is, even if you're not a caregiver right now, you probably will know somebody who is a caregiver or will become a caregiver in your lifetime. So it's not something that you can escape necessarily, because almost everyone will be impacted in some way, shape, or form. Are we getting responses?
We've got one from Julie that says utilization of those services, identification of these resources by management of the caregiver.
Right, so there's definitely that utilization issue. And then I think kind of the next step out from there would be, and if they're utilizing it, how is it actually helping? Are there ways that it's having an impact? Any other thoughts coming in?
Let's see. Said, without even mentioning caregiving, you could measure effectiveness through employee surveys that track questions like, my manager supports me as a person.
Oh, that's great.
Yeah, that's a good one.
Pretty basic, but reminding us that there are resources. Following up on that survey question that Karen had said, she also said another way to phrase it is like, or my manager cares about me.
Well, and that really gets at what the Harvard Business Review called the caring company, right? How do we create a culture of care? So that would be a great way to start to measure that.
Mm-hmm. And then Julie also commented, it's one thing to hear about it on hire, but then it probably isn't important, need reminding. Oh, sorry, but at that point in time, it isn't important. You need to be reminded. Oh God, they're flowing in now. Okay. Beverly says, if an organization had an official policy/support system that was in place, and then managers would ID someone who needed it, and then access the resource, that would be success. Gail said, if you could measure decreased stress and fatigue, increased retention. And then Jane says, roll out a program, build awareness of what is offered for caregivers, then do a follow-up survey and self-report.
Yeah, I think it's an interesting one to measure stress and fatigue. I think that starts to get a little bit at this idea of, can we look at the impact on health and well-being? I know when I was a caregiver, if a wellness program was being rolled out, to me, that actually just created more stress. I felt pressured to be participating in that instead of somebody actually helping me with the fact that I was no longer able to get to the gym. I was spending all my time driving and sitting in the hospitals and on the phone. And I think there are, especially with self-insured employers, potentially opportunities to look at, can we look at where caregiving begins and see if we're able to help that employee maintain their health and well-being instead of it often going kind of downhill from there.
And one more comment just came in from Douglas, and he stated possibly measure effectiveness of communicating these benefits before hiring to see if that had an impact on the hiring process.
Oh, that's really interesting. Yeah, so as a way to kind of look at attracting talent and saying, oh, this is a culture I want to be a part of because they have these types of resources.
And then one last one, if we want to move on, but Jane just said, train managers on the issues related to being a working family caregiver. Ask managers and supervisors for anecdotal feedback on impact of resources.
Okay.
Those are a lot of great ideas.
So thank you all for your comments. I think that was a really nice online discussion, if you will, about what could be possible. So we also want to talk to you about an ongoing study that we have. Because of the success of the nurse caregiving survey previously that Jerry had just presented on, and the nurses said, there are these things that we would like employers to offer. We decided to continue this investigation by asking healthcare leaders about the different types of caregiving resources that they could potentially offer for several reasons. One was that we wanted to know what kinds of programs would be the most impactful and meaningful for your organization, and what would be feasible, and also how would you measure the outcomes. So kind of to the point of the question that we just asked you related to measurement. And we are targeting healthcare leaders who would understand if such caregiving programs would actually be impactful or feasible. These are some examples listed here of the healthcare leaders we're targeting, such as CNOs and senior nursing leadership. If you know somebody who might be interested in this survey, it takes 10 minutes. Please forward them the link that is in this PowerPoint presentation. Feel free to contact us if you have any questions about it. Here, let me see if
We'll also be sending out an email to a thank you note after the fact, and I'll put the link in there so you don't have to scramble to write it down right now.
And these are some examples of the benefits or programs that we ask about in the scorecard survey. And we compiled this based on some of the things that the nurses said, but also some of the things that we know are in existence or could potentially be helpful. Okay, let's see if I can advance. Okay, so here's the link. And then Q&A. So I'll go back and just put it onto the link so people can write that down if they want to, or if they don't want to search through later.
Yeah, or please feel free to share it on social media or with your networks. And we're also interested to know if there's other groups or employers that are especially interested in this issue. We really are basically forming coalitions and collaboratives to really work on these within the workplace generally, or in the case of nursing, we're starting to form a coalition of researchers and employers and advocacy and product and service providers to really come together to see if we can start to move the needle with a specific group.
We only have another 2 minutes left, so if you have any questions, type them into the question box, and let's just get to the final slide or two to round up.
Okay, let me go forward. Okay. Here's our contact. Oop. Well, our contact information you'll get.
Yeah. So the deck is available under handouts if you want to download it now. I will also be sending you an email tomorrow with a thank you, a link to the recording, a link to the survey, and the slides as well. And I just want to let you know, thank you so much for attending. We have other events coming up that you might find interesting. We're having a webinar on December 4th on why it's important to design for newcomers. And that could be people that are visiting, tourists that are visiting the company that have never engaged with the American healthcare system before, or a restaurant, or anything else that might be different for foreigners when they come to the U.S. On the 19th of December, we have a webinar on designing choices. And on January 8th, we have an exciting one called Why is My Dog's Healthcare Better Than Mine? Learning from veterinarians on how to improve human health. And like I said, I can take one question. Okay, Gail. Gail just asked, what percentage of nurses are family caregivers? You guys know that?
I don't think we have an exact number on that. I mean, generally it's, so this is this problem, right? It sounds like right now it's probably around the same across workplaces, that it's coming in around 25, 30%. But that is probably underreported again, because people don't self-identify. And some of these things are usually convenience samples where it's only the people who self-identify who really report this in. So we need better studies on this, because the number is probably higher, but right now about 25 to 30% of people in the workplace are currently family caregivers. And it's probably going to keep going up from there.
Okay, well, thank you, Jerry and Diane. It was really great to hear your the conversation and to learn more about caregiving. And as a caregiver myself, it's very resonant to me. So I really appreciate you coming in and speaking about this. Everyone, as I said, I will be sending out an email tomorrow morning with all the information I mentioned, the deck, the recording, etc. So thank you so much for attending, and I've left up on the screen the contact information for both Jerry and Jae-yoon, as well as their Twitter handles. So thank you so much for attending. I really appreciate your engagement, and I hope to see you soon.